My name is Jenny, and I'm going to show you the mulligan with movement knee lateral glide extension. I'm going to have the patient lay on supine on her back. The indications for this technique is if there's pain, limited motion, or abnormal arthrokinematics. The rationale behind it is that it may correct positional faults that occur in some injuries and can actually restore joint arthrokinematics or mechanisms. Can also increase the afferent impulses to decrease nociception and is associated with decreased pain with movement. So I'm going to have the patient flex her knee. I'm going to put medial force on her femoral condyle and lateral force to the medial tibia. And then as I'm putting force, have her extend down without pain, come back up, and release the pressure. This should have an initial set of 6 and can progress to 2 to 3 sets of 10.
Hi, I'm Kellen Berry, and today we are going to demonstrate the Maitland technique specifically for the patellar glide. We're going to start by having our patient, Maxine, lay supine on the table. The Maitland technique tests for accessory movement that is accompanied by any physiological movement within the joint structure itself, and then accessory movement is any movement that the patient cannot do by themselves. Therefore, it happens along with the movement itself.
Okay.
To begin the Maitland technique for the patellar glide, you first need to identify the medial and lateral aspects of the knee. This would be medial, this would be lateral, as well as superior and inferior. The first technique is a grade 1 glide, which you just find your medial and lateral aspects and just gently move side to side. And this is for any pain and spasm that you would feel. The second grade is very similar. Just move it along inside there. And grade 3 and 4, which I'm about to show you, is for joint mobilization. So 3, you push it all the way to the end of range of motion and back, no further. Just where it wants to go. And for grade 4, you want to go all the way to the end of the range of motion and push with slight pressure just to get the stretch. And if any pain occurs, you go down with the force you're applying. And those are your 4 grades of joint mobilization. The patellar glide is a good way to stimulate biological activity within the joint. Small amplitudes cause synovial fluid to move within the joint, providing nutrients to the cartilage for restoration. This technique can also increase tensile strength and extensibility, as well as increase proprioception and afferent nerve responses from the area of the joint itself.
Hi, my name is Max Sutter, and today I'll be demonstrating a PNF stretch. PNF is short for proprioceptive neuromuscular facilitation. So to begin, we're going to have our patient laying supine or on their back. So I'm going to place my hand right at the ankle and the other one right at the hip just to help support it. And I'm going to bring the patient into a stretch or until he communicates that stretching his hamstring muscle. Okay. From here, we're just going to hold this for about 10 seconds. After that 10 seconds, you're just going to ask the patient to contract his hamstring muscle or to gently push against the hand at the ankle. So go ahead and push down. Good, good, good. Without moving that limb. You hold that for 6 to 8 seconds, relax, as you move the patient deeper into a stretch. Okay. Hold this again for about 10 seconds. Afterwards, you'll ask him to do the same thing with contracting that muscle. So go ahead and push down. Good. Relax. Making sure that he actually does not move the limb. And you go one more time into stretch. Okay. Hold that again one more time for 10 seconds. And push against me. Good, without moving that limb. And relax. And then you can just put the patient's leg back down. PNF should help in getting him into a deeper stretch, which can help with overall flexibility.
Hi, I'm Kellen Berry. Today I'm going to demonstrate a technique that can be used for gaining eccentric strength in the biceps muscle. Having eccentric strength is important because these contractions are what decelerate the body part in motion. If we're working on the patient's right arm, you're going to place your right hand on the posterior side of the patient's elbow. And with your other hand, you're going to place it palm down against the interior side of the wrist. Have the patient start with the elbow in complete flexion and tell the patient to resist you slightly as you push down into extension. This contraction should take around 4 seconds. Resist, 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 resist. Eccentric contractions can generate more force against their resistance versus that of concentric contractions because it requires less motor units to be activated, allowing more muscle fibers to be recruited to generate force. Eccentric contractions require less oxygen, making them more fatigue resistant